Assalamu alaikum and good morning. I'll welcome you all guys in the lecture of the series of the public health. In the today lecture of the public health, we will learn the three other types of the prevention method or measures. In the previous lecture, we learned about the one method of the prevention. It was called the control or controlling measures. Now, in the today lecture, we will learn about the elimination, eradications, and the extinction. Let's go through from the thematic definitions about the elimination. What is the elimination? The elimination is basically two types. The first is you can eliminate of transmission. Let's go through in the detail about the eliminations of the transmission. What you will do in the eliminations of the transmission of any infectious diseases, if any public health specialist or the epidemiologist introduce a new strategies or intervention or measures by which he can interrupt the transmission or the spreadness of any infectious disease. It means interruption in transmission or the spreadness of an infection. This now by introduce new strategies or new interventions or new measure, he can interrupt the transmission and the spreadness of any infectious disease and pull down the frequencies or the number, or you can say the number of the any incidence of an infection at zero level. So by the introduction of the new strategies which has been invented or discovered by any public health specialist, and by the introduction of that particular strategies and intervention, when the number of the diseases or the frequencies of diseases is come down or reduced at the level of the zero, that infection which was caused by a specific pathogen. The best example in the previous couple of the years, in the previous year, the COVID-19. The COVID-19 was a specific agent or the virus which has been introduced and which is caused by a specific pathogen in a defined geographical area. So now what's the next step? Definitely the new intervention which has been introduced by any researcher, if it continue, so what it will do? If it is continue, so it's keep down the reduction of infection. And the second one, what it will do, when the same infection become reintroduce, or you can say re-outbreak or re-epidemic, reintroduce or re-outbreak in the same geographical area. So what it will give minimum, level of risk. If the same intervention which has been continue by a researcher, by a policymaker in the same geographical area on the elimination of the same infectious diseases. So if the same infectious diseases become a reintroduce or re-outbreak, that it will not give the maximum risk, but it will give the minimum risk. Okay, so what it will be, the process, the process of the documentation, of the elimination of the transmission of an infectious disease is called the verification. Keep in mind, when the same process, when you will document the process of all the transmission of any infectious diseases about the elimination, this is called the verifications. Okay, now we will go to learn the next type of the transmission. Okay, let's go to learn about the second type of the elimination. This is called the elimination of a public health problem. Okay, or you can say disease. The first type was about the inflammation of the infection or the transmission of the disease or the spreadness of disease. The second one, you will go to adopt a preventive method by which you can eliminate a disease. It is the same thing. It means you reduce the frequency or the number of incidence of a disease again at the zero level by introduction of an intervention. Okay, or you can say strategies. When again it's become a reintroduce, then again it cannot be affected that maximum number of the people will not be affected by the same disease. As again, if it is reintroduced, so what is, it will not affect the maximum level, or you can say the population. Okay, it is similar like the transmission of the and the transmission of diseases. You will apply any intervention or strategies by which you can eliminate or decrease the number, reduce the number of any infection disease, it cannot be transmitted to the other pupils. So in the elimination of the disease, you introduce any intervention or any strategies by which you can eliminate a disease at that level, at the zero level, and you keep continue the same strategies and that particular that particular geographical area and in a specific population, that if it become a reintroduced, it will not affect the maximum population or the maximum people. Okay, so the process of the documentation of elimination of a disease is called validation. In elimination it was the transmission, it was the verification, but in the disease elimination it was called the validation. And this is all affects by the deliberate efforts. It all happens by the deliberate efforts or the strategies which has been done by any public health specialist, or by any policymaker, or by any researcher. Okay, he reduced the number of the diseases at the level of the zero level. Okay, so the best examples of the transmission of the disease was the measles and the poliomyelitis. Okay, it was the examples of the elimination of the transmission. And the example of the is called the neonatal tetanus. Okay, neonatal tetanus. Okay, or you can say tetanus. The tetanus is the best example of the diseases which is decreased at the zero levels, where it cannot be affected the maximum number of the people when it is become a reintroduced. Okay, now the third types of the is called the eradication. The eradication, it means the permanent reduce these any disease or infection at the zero level, means no any case remain at the large geographical area, or you can say at the global level. The permanent zero level of any disease was remained for the long time period, and the large geographical area or at the global level, it is called the eradication of the disease. The permanent eradicate or the end up of any infection or disease from the globe or from the large geographical area, it is called the eradication. And the best example of it is the smallpox. The smallpox, which has been eradicated from all over the world. Okay, so the process of documentation, of an eradication is called certification. Okay, any infections or any disease, has been eradicated from the any large geographical area, or from the any country, or from the all over the global world. The process of that documentation is called the certification, and this certification will be given by international agencies like by the WHO and the UNO and UNICEF, especially the WHO. The WHO certified to the any country or any geographical area or the all over the world that this disease has been eradicated from the all over world. So the certification process by the any international agency, it is authenticate, or it is give the granted the level of the eradication of any infectious disease or the any disease. Now the another last one is the extinction. The extinction and the eradication is a little bit different from each other. Extinction means when any infectious agent or any disease is no more exist in the nature or in the laboratory. Okay, any infectious agent or pathogen, or you can say any disease, is no more exist in the nature or in laboratory, and this is called the extinction. And no any example of the extinction is present till nowadays. Okay, so you cannot means say authentically so that the any infectious disease has been eradicated, no more exist in the nature or in the laboratory. So when any infection disease or the agent or the pathogen which has been eliminated, or has been end up from the nature and from the any laboratory, that term is called the extinction. I hope in the today lecture it is clear your concept about the three other types of the prevention. The first one was the elimination. The elimination is to reduce the number of the incidence of the cases at the zero level. So when it become a reintroduced, it cannot be infected, or it will not give the maximum risk to the population or to any geographical area. So it has two types. One is called the elimination of the transmission of infectious disease, and the second one is called the elimination of the disease or the public health problems. Okay, the documentation process of the elimination of the transmission is called the verification, and the best example of this of the elimination of the transmission is the poliomyelitis and the measles. And the other types of the elimination is called the elimination of the disease. The elimination of disease to reduce the number of the disease in a specific population in a specific geographical area at the zero level. When it become a reintroduced, but it cannot be affect the maximum number of the peoples. The process of the documentation of the elimination of the disease is called the validations, and the best example of the elimination of the disease is tetanus toxoid. The other terms we learned about the eradication. The eradication means when you reduce the number of the any infectious or disease are permanent at the zero level. That's called the, or permanently it is eradicate, or it is a end up from the large geographical area or from the globe, from all over the world. It's called the eradications, and the best example of the eradication is called the smallpox. And the process of the documentation of the eradication, that it has been given by some international agencies, which is called the WHO, and it is called the certification. When the WHO or the international agencies give the certification about the any disease or about the any infection, the certification, this means this disease is no more present or exist in that geographical area or in that global, at the worldwide levels. And the other terms is extinction. Extinction is means the any infectious agents or the disease is no more exist in the nature or in the laboratory, so it is called the extinction. I hope in the today lecture it is clear your concept about these terminologies of the public health, of the prevention and the types of the prevention methods. I request you all to watch my video lecture properly. It will enhance your knowledge about the public health. And I last request you subscribe my YouTube channel and press the bell icon. By pressing the bell icon, you will get my new lecture as soon as I upload on my YouTube channel. Thank you so much. Allah Hafiz. Take care yourself.